Welcome to the Greater St. Louis MGMA's August 2022 webinar. Before we get started, we have a couple of quick housekeeping items. All webinar attendees will be in a listen-only mode. The chat feature will be used to take any questions, so please feel free to submit your questions at any time during the presentation by clicking on the chat icon at the bottom of your screen. The questions will be addressed at the end of the speaker's formal remarks. Today's webinar is being recorded, and a copy of the recording and any available slides will be posted on our website under the online education section of your member center. Thank you again for joining us for the August 2022 webinar entitled Controlling Your Image, Reputation Management for Your Healthcare Organization, presented by Sue Webb. I'm going to now turn the controls over to Sue.
All right. Hi, everybody. Let me know if you can see my screen. Can you see that?
I can see it.
Okay. And you can see the presentation and not my personal notes. Is that correct?
Yes.
Okay. I just want to make sure. Not that I have anything that salacious in there, but I don't want to give anything up before I have to. Anyway, thank you, Courtney, for introducing me. And I am actually, I should have turned my screen on, but I'm not going to since no one else has theirs on. But I'm Sue Webb, and I am with Corktree Creative, which is based in Edwardsville, and we are a full service marketing agency. A little bit of background is that my previous role was director of marketing for a large healthcare organization in St. Louis that was based in St. Louis and had locations in Kansas and Missouri. And I was actually a client of Corktree Creative for several years, and I liked them so much that I took the leap over. But our organization, Corktree, works with a lot of hospitals and medical groups and pharmaceutical companies, surgery, PT centers, franchises, all kinds of stuff. So this is definitely a niche industry area that we're heavily involved in. But it's not about that. This presentation is about your practices. So I will go ahead and get started. So the goals today, as we're lined up in the notes, and we added another one in, is leveraging your online listing sites for SEO and implementing a review reputation management program, creating an ongoing plan for your review reputation management, and then having some takeaways from this presentation that, I know very well how hard it is to get budget a lot of times from your providers or your, the owners of your practice, and having, very clear selling points to gain budget so that you can do search engine optimization and reputation management is really important. So to get started with this, the reason we're talking about all these things is there are a lot of things that are outside of your control with a practice. Billing is outside of your control. What people say is outside of your control. And people can say publicly bad things about you that you don't have any control over, but you can guide that narrative to a degree, and in the process of that, you can help with your optimization. So, what is search engine optimization? Basically, in a nutshell, it's a process of getting highly targeted website traffic for free. But in the same vein as that, search engine optimization is very tied into reputation, and that's why we're talking about both of these today. So, the big goal of SEO, as we call it, is to improve your website's position on search. And the biggest search engine out there is Google. So we will spend quite a bit of time with that. But you're getting your website listed and your providers listed. Basically means when you optimize it is that more people are going to see it. And then the other thing is that the higher that you are listed, your click-through rate, your CTR, which means how people get to your site, is much higher the higher up you are on a page. So looking at this screenshot I have over here of, I did a search on Bethlehem, Pennsylvania family practice. doctors. So this is called the 3-pack. Those are the 3 that come up initially in search, and that is determined by a lot of factors that we're going to talk about. And then these down here, these are not advertisements. These are organic searches that, because of the way that the content was written and the information in it, that these rose to the top. And right here, like it shows, is 19.3% of search queries. If you're on the first position, you get clicked on. That's really big. Okay, so like I said before, Google accounts for a huge amount of search, which, and I do want to say, if you have any questions or if you want to jump in at any point, I'm certainly happy to take questions as we go, and we'll have time at the end. And then you can also email us if you have questions. And I'm really trying to keep this as high level as I can, but there's a lot to share because there's a lot to talk about. But anyway, going back, so 89% of mobile traffic is on Google, and so obviously that's who you want to impress. That's where you want everything to be. You want to be buttoned up and all your information out there so that Google can find you. Well, how does Google determine how you get in that 3-pack or at the top of a page? Here are 7 ways that they do it. So one of them is your Google business profile, which used to be called your Google My Business. We'll talk about that. Also, reviews, having many reviews and recent reviews, that helps you show up on a Google search. Citations are very important, and we will touch on those also. Those are like listing sites and directories. That's what a citation is. And then obviously your website, it really needs to be robust and clear with a lot of good information. And along with that are links that go in and out of your website. The 4 at the bottom, I'm not going to go into those in detail because there's so much to talk about with these other 3. And then personalization and behavior, that's actually how, when a person searches for, let's say you're searching for a ENT in Creve Coeur, the words that they use to search, that's like the behavior, and the personalization would be like, both of those are where they're searching from. Was that person in Creve Coeur when they were searching, or were they in St. Charles and they were searching for a provider in Creve Coeur? So there's a lot of other factors, like your device is a factor. We're only going to talk about the top 3. So, all right, so let's talk about the providers. So there's all these people that are coming in. So the providers are, I don't know if you guys can all hear that ding dong every time it happens, but anyway, so the provider online listings, those are really, really important. So we talked about how Google is so important. It's number 1, obviously, but all these other places where your providers show up, it's really important to make sure that you have your information on those sites and that it's set up correctly, which we'll go into. But so right here we have, these are the top listing sites. So Google My Business or Google Business Profile, being on Facebook, surprise, surprise, Health Grades and Vitals. And so we'll click through to this Health Grades listing. I'll pull this over. So hopefully you guys can see this. This is actually my cousin. So he's filled out his profile really, really well. And see what he wrote in here. And I just looked at this today for the first time. He wrote in here all the things that he treats. He talks about safety and accuracy, and then all these really highly coveted keywords. He's writing those into his Health Grades listing, or for someone in his practices. Oops, hold on. Where did I go? I lost my presentation. There we are. Okay, so going back. So these are I was talking about all these listing sites. Yelp. I'm not a big fan of Yelp because it's a very much a pay to play site, but they do have free listings that you should gain control of. They'll hard sell you and try to get you to buy things. You don't need to do that. ZocDoc, as you guys probably all know, is an online appointment setting, but they also have a pretty robust listing. And a lot of people don't do ZocDoc. US News, You might see that pop up quite often. US News is actually an aggregate, which means it pulls this information from a number of sources, as does Health Grades, as does Yelp, as do all of these, but they are a 100% aggregator, and I don't believe you can control that. And then the last one, which is super vital to making sure that your listings are correct, are your insurances. And if you're a small organization, the people on this call might be the ones that are doing those listings. But if you're a large organization, you may have one person that focuses on that. And what I'm talking about with this, oops, it keeps bouncing around. Hold on. Let me click back through here. So what I'm talking about with this is getting control. So let's say your providers are on they have Anthem insurance, which they probably do. And they may have gone on the site and you guys got them signed up years ago. Well, the information could change. Your location can change. When you probably set them up on this, there weren't a lot of options of what you could put on there, and they did it for you, but you can actually go back to the providers and get these maintenance forms, and they all do it a little bit different. But see here, you can show your areas of expertise, which is perfect, because then you can start writing in what your providers do, conditions and treatments that they treat, because all those things influence what Google does on finding you. It's amazing. They'll go through and they'll look at all these sites and they'll pull all this information. So the more robust, even though it's just on insurance that you don't think anybody's looking at, Google is looking at it. Okay, so let's move on to the next slide. Go back here. Okay, so how do you do it? Well, it's a big job. And that's, we come in here, but if you want to do it yourself, you can. So the first thing I would say is, and I don't have it on here, is you really need a single source of truth, which is, they call it a SSOT. And basically an SSOT is a very, very robust spreadsheet that has your name, your provider's names, their address, their phone numbers, their hours, their URL, what they treat, where they've gone to school, all of those things. And it has to be very, very, very defined, and it needs to be the same. So the reason why you have this single source of truth that very few people have control of is a lot of times people will start, instead of saying court, they'll say CT, or if they, let's say that sometimes you put the doctor's middle initial in, sometimes they don't. That can be confusing to the bots like Google that are going through and they're pulling all this information. So you need to make sure that all these things are perfectly consistent. Having a very, very, having this gated, this single source of truth is very important too, so that people don't go on it and make changes. It really should only be one or two people making those changes. So first you have your single source of truth. Then the next thing is taking ownership of your profiles and all your directories, like I was showing you. You can take control of Google, you can take control of all of those, because what happens if you don't take control of it, the information is auto-populated by AI, and then all of a sudden you've got crazy stuff on there, as you often see on listings. And then the next thing is making sure that you put images on of your providers, of your logo, of your office, but do not put stock images on, because those are not looked upon kindly by the bots that go through. They want to see things that are actually very real life. Okay, so the next slide is we're going to talk about how you do this and why it's important. So this provider that I pulled up here, this is someone that we work with, and this is actually the location. So this is what people see on the front side of a Google listing. And so they see, their name, or I guess on this one, it's not their name, but it's the practice name, it's location, it's the phone number. Down here, this is information that we had filled in, but this is what you're seeing on the front side. But let me show you what's actually can be done on the back side of this. And you may or may not know this. So I click through. This is the Google business profile for this provider. And so that was Alton that I had shown you. So this is what the back end of it looks like. So I went in and we've filled this out. So if you look at it on the front side, all it said was medical clinic in Alton, but we've gone in and we put in all of these other practices types, these specialties that are actually in this location, because those are keywords that people are searching for. So let's say I'm looking for an OB-GYN in Alton. Well, I have OB-GYN in here, obstetrician gynecologist in here, but then down here, we've written in, this is in the description that I showed you earlier, we've written in, the street words that people use. They use OB-GYN, behavioral health practice, things like that, things that people actually say. We've written into this so that when people are doing search, they're seeing these keywords are actually coming up, and then they're realizing, oh, that's what this SIHF Healthcare Alton is. And you can go in and you can put in photos. We've put in a cover photo and a logo and a location, and these are actually people that put their pictures in. And if they're inappropriate pictures, you can have those taken down. The key thing I'm saying from all of this is that you have a lot of control. And so going back to this listing, you don't see all of this on the front side, but you see what you do, but people that are searching are actually getting the other information that's important. Okay, so let's go to the next slide. Okay, so who should you do this for? We should do it for all of your locations and all of your providers, even if they're nurse practitioners. This is a great example. The goal is to show up on search, to be always up there on search. Well, if you're looking for an allergist in Brentwood, Tennessee, these people were super smart. So this allergy and asthma center, look, I've circled this location. This location is the same. So we know that all three of these providers are in that same practice. If you only do one for the practice or one for the provider, then you're missing out on all this free advertising. So I would highly suggest controlling those as well. Okay, so we've talked about getting on listings, and we've talked about showing up, and we talked about what the factors were for getting listed, and one of them is getting reviews. So let's say we're doing this in progression. So we've done our single source of truth. We've gone online, we've acquired all of our listings, as many of us as we can. There's so many, you can't do them all, but the top ones. And then you've done all of these things, but there's more to be done. So you want to get more reviews, because the more reviews that you have, the higher ranking you have. And the more often you get the reviews, like we said, the higher ranking you are. But also what's important with this is that you need to manage this, because you should be responding to any reviews that you get that are poor. You should be able to flag inappropriate or untrue reviews. And you can do that with Healthgrades. You can do it with Google. Insurance, I don't think they do that. But a lot of times what happens is, if you go into, let's say you go into one of the insurance companies, and you'll see all these reviews in there, and you think, I didn't know that I don't know how all these people did these reviews. Well, they're aggregating them from other sources, like from Google. So going in and taking control of this really helps. And then the next step is driving new reviews and doing it yourself. Now, we've all spent time, and I did when I worked with the practices, handing out cards, handing out, QR codes, doing all these things to get people to do reviews and asking them. But the numbers are just not high. It's just really hard to get them to do it. What we're suggesting is automating this. But before we go into that, I want to talk about also why this review management matters. And these statistics speak for themselves, but so we all know that a lot of people go to online reviews before they make a decision about their healthcare, and they will a lot of people used to just talk to their neighbor or to their friends, but now they go into these review sites. They look at their Google reviews. What I find astounding is after insurance and the location, the reviews are the third most crucial driver in making a decision to choose a physician or a provider. And then over 60% of organic healthcare searches result in a conversion right in the Google experience. So what we talk about the conversion right in the Google experience, and we're going to go into that more in a second, is when the person is doing a Google search and let's say, Ryan Fitzgerald comes up, and Ryan Fitzgerald comes up on the Google search, and I see that he has a bunch of star ratings. I don't even click through to his website. I click through and immediately make a phone call. That's the fact that over 60% of that is happening in the Google experience before they even get to the website is amazing. And that's why it's important to have these optimized and have lots of reviews. And then 72% of patients prefer choosing providers rated 4 stars or higher. Well, we all know that you all have patients that are not going to be happy. I mean, I dealt with it every day. I'm sure you guys have dealt with it every day. And a lot of times you can kind of get it to work out, but sometimes they go off and they'll say terrible things. And then you get 2 or 3 of those. And then all of a sudden your star rating is like a 2.5 and you think, how did this happen? Well, you don't want that to happen because of this. 72% choose 4-star or higher. And then also 72% look at those reviews. And then the last thing is 50% of the people that are looking at reviews look at 10 or more and 20% look at 20 or more. That is a huge number. That is more of a determinant than almost anything else that you can think of. So the thing is how do you do this? How do you automate it so that it's not so difficult? Well, technology has just altered the way patients, the way that we can reach patients. And what I'm going to show you has several steps to it. And we've implemented this with many clients, and I did it at the practice that I used to work at. And I can't say enough great things about it, but I'm going to show you how you do it. So basically what you do is you use your EMR, and this is all legal. You use your EMR and it pulls similar to what you do when you send appointment requests or appointment reminders out. Patient comes in, they see the doctor, they leave, and by amazing science and magic, the technology is there that you can control. Like if someone comes in and it's their first, let's say it's their first visit, and they're in for this treatment or whatever, you can dictate who gets these review requests, and basically it's automated. So they come in, they see the doctor, they leave, they get a text within 24 hours. We don't send the text immediately because you want them to respond to the review request at the location that they're at, not the location where the practice is. Because as you know, going back to the other example, you live in St. Charles, but you're looking for a provider in Creve Coeur. Well, that person is way out in St. Charles. Your phone is going to take all that data and figure out kind of where you're at, and then pull up one providers to the top of the list. So you want them to have a really good. You want your reviews to come from all over the metropolitan area, not just where the provider is. Because people travel in St. Louis to see the doctor in general. Okay, so they get the review request. So they get this text and it says, "Hi, thanks for visiting me. Would you like to send us a review?" Well, they can say yes or no. That is the legal way of doing it. That's how you do it. So we're going to talk about yes, but let's talk about no. So if someone clicks the no button, then they get another text, and I don't have it up here, that says, would you still like to give us a private review and make a comment? And what we found is that that percentage or that star rating that they give you and the comments that they make are generally lower because people want to have an outlet to complain, but they don't want to do it publicly. But some people do like to do it publicly, but they don't want to do it publicly. And so this gives them the opportunity to do that. What that also does is if they click yes, so they click the yes button and they go to one, and then then this next screen comes up and they can go to Google, Facebook, or Healthgrades, whatever, and you can determine what those are depending on your providers. Then if they want to say yes, then you've given them the opportunity, mostly the people that are happy, to go out and give you a review. It's crazy. And personally, I think asking someone when they come into the office at the front desk, your front desk people are busy. And then when they're checking them out, they're still busy. So asking is hard, but automating is really easy. Okay, so next thing. So how does this really work? Well, think about it. These are two practices that are within a mile of each other. One chose to do the automated reputation management and the other one did not. This is the result. So if we're looking at this, look at these. This is crazy. They've had 530 Google reviews with a 4.8 rating, and this one had a 2.5 rating with 8 reviews. Well, if I was picking, I know which one I'd go to. So let's show another example. Or these are actually once we automated these 3 clients, these are the results. So the first one has 30 locations. They have 159 primary care and specialty providers. They started the reputation management process in May of 20, and they had 43 reviews with a 3-star rating. By June of 2022, they had 7,509 reviews with a 4.7 rating. Second one, this one they added Facebook in, and you can change it up however you want. You can have 75% of them go to Facebook and 25% of them go to Google. You can have all of your mid-levels. Those reviews could go to the practice location, and then the doctor could get all of the doctor reviews. You can do it however you want. You can slice and dice it in a million ways. But so this one, they started in February of 19, they had 63 reviews, 3.7 star rating. Now they have, in July, they have 9,994 Google reviews at a 4.7, 1,000 Facebook reviews in 19, and 13 or 3,600 now. And then the third one I put in there because this is one of the largest federally qualified healthcare centers, and they serve a really, really underserved population. Now, they didn't have many reviews, but their star rating was very, very low because of a lot of factors. And so they automated their system, and they were pretty selective about which providers they put into the automation. So even though the number of Google reviews is lower, they were able to get their star rating up really, really high, which has helped with a lot of things that we'll talk about in a second when we talk about the takeaways from this. Okay, so let's look at this even in a finer point. So I'm going to actually use a pointer for this, if I can do it. Okay. So the yellow here, so this is one of the practices that started with our program. And this line right here, this gray line right here indicates the white on this side is before they started using the automation, and the right is after. Same over here, right and left. Now this is the same practice, and what we're showing here is when they started, this is where their star ratings were. See these numbers over here? And then they started the automation and their star ratings went through the roof. But at the same time, this blue one, this shows how many people looked at the Google business profile, which is Google My Business, how many people actually looked at it. So this was before they automated. And as soon as they automated it, because the star ratings were going up, there was a lot more interaction. All of a sudden, their profile views just went through the roof. Same over here. What we're showing here is the actions from Google. So we're showing the people that visited the website and the calls. Now, what I said before is that getting people to make an action while they're in Google is, everyone wants that to happen because you're getting kind of the sell before you have to click through the website and do the forms or call from the website. So having this number flat is fine, but this number, and these are the number of visits to the website. This is fine. This is fine. It's actually good. But these are the people that are actually calling from Google. So here at this point in, they were getting 1,000 calls. All of a sudden, they're bouncing up and down. And as you know, a lot of this is cyclical because of time of year and a lot of other things. But what we're showing is that it is a remarkable difference. Okay, so we're going to show it again over here. This is another client. Once again, the yellow star shows the Google star rating right here. And then the blue shows the profile views right here. It's remarkable, and in my experience in working with healthcare organizations, numbers don't lie, and providers like to see these kind of numbers because it's not conjecture, it's not someone's thought, it's things, it's showing actual hardcore data on how this works. Okay, so over here, these are calls and visits to the website. Once again, on the white side, those are people that hadn't used a reputation management system. And on the right, those are the ones that had. So you can go in and you can ask people to do reviews, but having that, consistently and having it going is really, really important. Okay, so going back to, one of the things so I'm done with that part, but how do you do this? And I know you all are probably thinking, which I thought too when I was doing this. This is a really, really big job, and I don't know if I can do all those pieces of it because I have 100 other things I have to take care of. So this is the reputation management plan that we propose to people that you do yourself, or we do it for you, but you can do it yourself. So as I said, you set up the single source of truth. You determine who can modify this source of truth. You populate that documentation with NAP, name, address, phone number, but there's a lot more than that, as we discussed. And then you cross-reference with the website. You make sure that your single source of truth is actually correct on your website also, because it has to be correct there also. Okay, then what do? You go out and you claim all the existing, and right here I'm talking about Google, but it's the same no matter what if it's a directory, if it's an insurance site or whatever. You go out and you claim all of these sites, and then you optimize. So how do you do it? You obtain the lists that are on there that are of all the active providers and locations. You request the ownership of them. You optimize those with the things we talked about. You can actually link to appointment scheduling on Google now. And what a lot of practices do, because they don't have automated, they don't have a link that goes to like a third party thing like ZocDoc that you can schedule online. They'll send it to a form. And then in the morning when the practice opens up, one of the scheduling people will open up all those emails they came in and then call the people back because you want to respond as quickly as you can. And then writing descriptions and pictures. The other thing that is really, really important, and I'm sure you all have seen this, especially with Google, but it's the same on listing sites like Health Grades and Vitals. All of a sudden, there are all these extra ones out there. And you're like, where did this come from? Well, it came from because, you may have had Dr. John Q Public, but you might have done John, no Q, and then Public, or you had John Q Public MD, and it should have been DO. And then all of a sudden, all these new sites are being created. Address is wrong, whatever. So you want to go out there and you want to remove all the duplicates. And then if you have providers that have left, go out and close those out or pull those down. Because the reality of it is if you had a provider that's been practicing for 30 years or 40 years and was really, really loved, they're going to go to the top. They're on search. And you don't want your own doctors competing with the doctor that's left. Now, this is a hot tip that I'll give you. A lot of times on Google, what I've done and what I've advised and what I've done with other practices is if you have that doctor that's been there for a really long time and they leave, you might want to just leave their listing up for a while and just make sure that everything links back to like appointments or someplace else on the website, not the provider's page, but maybe just drops onto the website so that you can capture those ones that are people that are still looking and this provider gets hired. But then after about 6 months, you need to pull them down or even less than that and not have them out there anymore because you don't want your doctor competing with it anymore at that point, the other doctors. Okay, so create the new GMB listings and optimize. We already talked about this very well. You need to set up, for Google especially, you need to set up a dedicated Gmail account. Because you have to set it up through Gmail. You can't use your own email account and then do all of them through that. And that's how you can do that dashboard that I showed you. And then make all the keyword updates that we talked about. Okay, then executing. So executing, when I talk about this, is executing your review process like we were talking about. So the way that those work, if you do it automated, is it connects with your EMR. And so how does that, that's a big lift. If you have IT people, or if you are the IT people, you're going to have to do this yourself, or you can implement, help of someone else. But basically you work with the staff to determine what codes and which patients should get the form or the automated review text. And it can actually be a text or it can be an email. It can be an either or. Another thing that I did not put on this slide that I should have is that there's some compliance that's associated with this. So if you have an attorney that you guys work with, it's a compliance officer, or whoever the third party that whoever you would work with to do automated review, they'll help you with it. But basically, you need consent. And a lot of times you'll already have consent from your patients because you're sending them information, but you need to make sure that your intake forms show that consent, that they can receive a text or an email. You probably already have that set up though. And then the last thing is just launching the platform, and then ironing out any kinks. And then ongoing would be supporting all your listings that are already there, make changes, make updates, manage all of the platforms, create the new listings and optimize, and then pull down, like we said, pull down departed or change locations or things like that. And then do the orphan listings that we talked about. And you have to do that on an ongoing basis. And then if you make any kind of changes to your single source of truth, then you need to go back and make the changes out there, or you'll get way behind, which I've seen happen. And people, they didn't keep up with it for a couple of years. And then all of a sudden, all of their listings are messed up and their doctors weren't ranking. Okay. So I told you that I would talk about how you can, points that you can take back to gain support from leadership to do these things and spend the time on it. First of all, possibly pay for it to have it done, but just to do it. First of all, it's ranking higher. We talked about that. The second thing is elevating your brand, especially like I showed with the one allergy practice. Those people were, they were leveraging their brand all over the place. And if you click through, they also had their logo on there. They had a lot of consistency. That is really important. The next thing is converting patients sooner, like we talked about. So you can get them when they're earlier in the clicking process, because they're converting either on like Healthgrades or Vitals or the insurance site, or they're converting on Google, because do not discount those other sites. People do look at them. And if you don't have a picture of your doctor that's current, or if you don't have any information on it, they're just going to go to the next one that has a picture or has reviews. And then I really think these next two are really important. Actually, I should have changed the order, but it provides feedback. Operationally, it's amazing the things that you uncover on these reviews. Because people will say things that they may not say to you to your face, and then you can see consistencies or inconsistent. You can see consistent deficits or strengths, and play on those. So identifying weaknesses and strengths. And then the last thing, I forgot to say, recruit providers. I messed that one up. So recruiting providers is really important. It's also recruiting staff. People want to work at places that have good star ratings. They want to be proud of the place that they work. And especially with providers. You probably have a provider that comes in from another town, and they get dated. They go on all the dates with all the local practices, and then they decide which one they're going to go with. Well, you'll be darn sure that they're looking at your reviews before they do that. And if you're not on, if you don't have good reviews and you don't have, happy patients, they're probably going to walk on by and not look at you. And you won't ever get to go on a date with them. And then enhancing morale. Like I said, people really like to work at a place that people are happy and that the patients are happy. And this is certainly an issue right now because there's such a shortage of staff that if you show that you have an awesome environment, you're ahead of the next guy. Okay, so one last thing I wanted to show is, I don't know if you guys follow this, but Google Health is basically a division of Google that is focused on health, and they do a lot of things internationally with underserved, but they also, they're the ones that are influencing how Google is changing in regard to healthcare, obviously. And so once a year they do like this thing called the checkup, and it's it's a bunch of videos and all kinds of stuff, but I distilled this down just to like a minute video. And basically it's talking about things that are the future of Google, because Google, as we all know, controls so much, and there's a lot more to come. And I can't necessarily say I like this, but I think it's something we all need to know. And you may not know this. So I'm going to go ahead and I'm going to play this. Let's see, I'm going to turn off my pointer here. Okay. And let's move this over here.
We're really excited to announce that in the coming weeks, we'll make it easier to find healthcare appointments by showing available dates for local providers on Google search. Maybe, like many of us during the pandemic, you've recently moved and you're looking for a new doctor. Or maybe you've put off getting your annual physical checkup. Or maybe your child needs a same-day visit. Our broader efforts are focused on how to help you get care with less friction. We started by showing you which doctors accept your insurance, and now we are expanding access to available appointments as the next step to help you stay safe and healthy. We are just getting started with a few early partners, and we are excited about making your health journey easier.
So what does that mean? Well, that means that Google is getting into the business of scheduling. And as you know, and you probably have seen it on your providers listings, they already have gained access to all the insurances that your providers are on, and people can click through and see that on their profiles, on your profile on Google. But now they're getting into this, and I don't know how they're going to do it, but I guess the point of this is they are constantly changing, and they're constantly updating and staying ahead of it by making sure that your Google profiles are in shape, and you're following what's going on is really, really important, because if you don't stay on top of it, your providers will lose ranking, and it won't help with, a lot of things like getting new patients. So anyway, so a couple last slides and then I'll be done, and then we can take questions. I do want to talk a little bit about us. Oops, let me go back one. Let's see. So Corktree Creative, like I said, we're in Edwardsville. We're full service. We are a fun bunch of people that have a lot of experience, but the biggest thing is that we are full service. We do everything, and we do it all in-house, which is unusual for an agency. We're not extremely large, but we're extremely responsive. So, we love our accounts. We spend a lot of time with our accounts. We spend a lot of time getting to know them, and we understand healthcare. And then the one other thing is a little bit more about us. These are all the awards we've won. I do want to point out a couple of things that we're really proud of. We're a women-owned small business, and we're certified in that. And we're also veteran-owned. We are almost 90% women here, and that makes us doers. That's all I'm going to say about that. Anyway, so if you guys have any questions, I'm going to get out of here. I'm going to stop sharing my screen. I will turn on my video. And if anybody has any questions, I'm happy to take them. Or not.
So remember, just use the chat feature down at the bottom icon, and we will read the questions off and have them answered.
I should turn my screen back off so I don't sit here awkwardly and not say anything. Anyway, but if you have any questions, we're going to put the slideshow on the portal, and we will, we're always available. Like I said, we're Corktree Creative in Edwardsville. We have a lot of St. Louis clients. Let's see. I do have one question. It says, if we started from scratch, what's the best jumping off point? Well, I would say by, looking at that, the steps that I showed is gaining all of your listings. Start with Google, Google, Healthgrades, Facebook. Those are the main ones. And then making sure that your hospital listings, that is where I would start with it. And then if you want to do the next step of the reputation management, there's third parties that do that. So you would work with somebody like us to set that up, because you can't do the automation on your own. It's super high tech. And like we do it for several clients, and we monitor it. And so one other thing I didn't tell you is that if let's say you get a really bad review, and a lot of times you don't even know about it. when we do this, we automate it so that you get a bad review kickback. So you'll get a notification that there was a bad review, and then you can go in and you can address it. So I don't know if that answered your question, but yeah. And she said, share my contact information. The other question was share our contact information. I'm going to put it back up. And that I don't think I have any other questions. So anyway, but we do everything. And, I worked with MGMA in the past, and it's a great organization. I really appreciate having us on to talk about this. We're very passionate about it, as you can see. All right.
Okay, well, I want to remind everybody that the information will be in your member center once you log in under education. So I will make sure that the video, all the slides and the contact information are posted.
Okay.
And since I do not see any more questions that came in, this will conclude today's webinar. And I would like to thank everybody for attending, and a big thank you to Sue with Fort Creek Creative for the informative presentation.
Sure.
And I hope everybody has a great day. Thank you.
Great. Thank you. Bye.